Good morning, everybody. Honorable Principal, Chittagong Medical College, the Director of Chittagong Medical Hospital, and Divisional Director, Health, as well as the Chief Medical Officer, Chittagong City Corporation, distinguished guests, and the doctors and audiences. The main things are that dengue actually is nowadays is very common. In Chittagong, varies in other cities. Though dengue fever is a mosquito-borne illness that occurs in tropical and subtropical areas of the world. Mild dengue fever causes a high fever and flu-like symptoms. Obviously, our keynote speaker, we have already expressed his views. The severe form of dengue fever, also called dengue hemorrhagic fever, that is very dangerous. And that can cause serious bleeding, sudden drop in the blood pressure, shock, and death. Millions of cases of dengue infection occur worldwide each year. Dengue fever is most common in Southeast Asia, the Western Pacific Islands, Latin America, Africa. But the disease has been spreading to new diseases, including local outbreak in Europe and southern parts of the United States also. In Bangladesh, you can say many people experiences initially no signs or symptoms of a dengue infection. When symptoms do occur, they may be mistaken for other illnesses, just as the flu, and usually begin 4 to 10 days after you are bitten by infected mosquitoes. Dengue fever causes a high fever, 104 Fahrenheit, and any of the following signs and symptoms. There may be the headache, muscle, bone, or joint pain, nausea, vomiting, pain behind the eyes, swollen glands, and rash. Most people recover within a week or so. In some cases, symptoms worsen and can become life-threatening. This is called severe dengue hemorrhagic fever, or dengue shock syndrome. Severe dengue happens when your blood vessels become damaged and leaky, and the number of the blood-forming cause platelets in our bloodstream drops. This can lead to shock, internal bleeding, organ failure, and even death. So what are the warning signs of the severe dengue fevers, which is a life-threatening emergency? The warning sign usually begin the first day or two after the fever goes away, and may include severe stomach pain, persistent vomiting, bleeding from your gums or nose, blood in your urine, stools, or vomit, bleeding under the skin, which might look like bruising, difficult or rapid breathing, fatigue, irritability, or restlessness. So, the very common causes of the dengue causes are caused by any one of the 4 types of the dengue viruses. You can't get dengue fever from being around an infected person. Instead, dengue fever is spread through mosquito bites. The 2 types of the mosquitoes that most often spread the dengue viruses are common both in and around human lodgings. when a mosquito bites a person infected with a dengue virus, the virus enters the mosquitoes. Then when the infected mosquitoes bites another person, the virus enters that person's blood streams and causes an infection. So actually the thing is, nowadays, more complications of the dengue, the severe dengue fever can cause internal bleeding and organ damage, and blood pressure can drop to dangerous levels, causing shock. In some cases, severe dengue fever can lead to death. Women who get dengue fever during pregnancy may be able to spread the virus to the baby during childbirth. Additionally, babies of women who get dengue fever during pregnancy have a higher risk of the preterm birth, low birth weight, or fetal distress. So nowadays, actually, our main aim, prevention. The prevention is better than the cure. First of all, we must have discussed about the vaccines. So I heard from our Chilean Medical College principal, there are a lot of research that are going on in Bangladesh. 2023, probably they introduced the vaccines, but still not marketing in and around the cities of the Bangladesh. Still, experiment is going on. If I say the vaccines, dengue fever vaccines may be available for people ages 6 to 60 years. Dengue vaccines is a series of 2 or 3 doses, depending on the vaccines you get over the course of the months. These vaccines are for use by the people who live where the viruses that cause dengue are common, who have already had dengue fever at least once. The vaccines are not available in the continental United States, but in 2019, US Food and Drug Administration approved a dengue vaccine called Denguvexia for the people ages 9 to 16. So mainly prevent mosquito bites, that is very important. The World Health Organization stresses that the vaccines is not an effective tool on its own to reduce the dengue fever in areas where the illness is common. Preventing mosquito bites and controlling the mosquito populations are still the main methods for preventing the spread of the dengue fever. If you live in or travel to the area where the dengue fever is common, these tips may help reduce the risk of the mosquito bites. Just like stay in air-conditioned or oil-screened housing, wear the protective clothes, use mosquito repellent, reduce the mosquito habitat. And what I say, some sorts of the solutions like the bleaching powder solutions that I personally introduced, that is 8 to 10 years before in Chittagong. There is bleaching powder solution, 0.5% chlorine solution. As because this is not the bacterial disease, this is the viral disease. So the bleaching powder can act against the viruses effectively than bacteria. So I practiced that what I said 8 to 10 years before. The bleaching powder solutions in and around the cities, that is, I made effective. As you can see, in and around our cities, our main theme now, clean, green and healthy city. Under that theme, we don't throw any sorts of garbages, any sorts of plastic bottles, any sorts of nutshell or any sorts of things that contain the water. That's very important, the stagnant water. The mosquitoes larvae that can spread very easily if there is stagnant water, like the nutshell or even the plastic bottles or even the constructive materials. So that's very important. So we must have avoid everybody. We must have join all sorts of the communities. If we involve the communities, the peoples, as well as the specialists and the peoples, so we must prevent the dengue. And that's the main aim should be. So this is a very important seminar that you arranged today. That I must have give my best wishes and thanks the organizers. The exact time that you arranged the seminar. So thank you very much, and hopefully have a nice time. Thank you everyone.
Thank you very much. And we thank the presence of the Honorable respected Divisional Director, Dr. Onswai Dumarman. Thank you very much.
Honorable Chief Guest Dr. Shankar Hussain, Honorable Principal of Chilla Medical College, Chilla Medical College Hospital, Chief Health Officer Chilla City Corporation, Mission Chief MSL, among Lanet Protection. Very good morning. Assalamu alaikum. I feel very happy to be here because MSL organized this timely workshop because Chilla is the second largest city in the country. However, we have few interesting points. As you know, long time ago, dengue was not detected in Bangladesh. And in around 2000, there was a fever in Dhaka. There's a Dhaka fever. They have a belief that this fever is not transmitted to anyone, only in Dhaka. Maybe the factory is not available in some other parts of the country. However, later we saw that the disease transmitted around the year, what we call behavior transmission. It is observed not only in Bangladesh, globally, pandemicity we observe, and in Chittagong, hopefully you know a few areas like Sitagundo, Hatajari, some pocket area. Those villages were detected as dengue villages by City Corporation and our health department. So, dengue, lastly, we recognize that dengue is not only limited in Dhaka, it's spread out throughout the country. And there are a few issues we had already heard from our two nicely presented two presenters. That is, by population and density, the people living in the country, Brazil is the topmost country because of the largest population. But if we compare the size of the population in the country, density, Bangladesh is the topmost. Where they group, prevalence and death. In 2023, topmost the number, leading cause of death is recorded in Bangladesh. There were few issues involved in the that is, there are few factors involved, like advocacy, commission, social mobilization, clinical management, vector control, environmental controls. In case of environmental control, not only city corporation alone involved, we need to involve by ourselves, like the community perception, like throwing many garbage directly in the drain of the city corporation canals, keeping home gardening and throwing the water everywhere, wherever there is. Nursery, keeping the tires here and there in the roadside, so water is collected, so breeding points are there. We can easily recognize. In addition to that, the residents' responsibility, we cannot ignore it. If we just look around, it is our blessing that our honorable mayor now is a very good doctor. He has a keen interest how to improve the dengue situation in the country. We said together several times, and I also advised the MSF Holland before, please arrange a workshop so that by asking him to be here, we can just make a discussion and organize a work plan how to develop the dengue control strategy in the country, particularly in the city corporation area. And the residents' responsibility, and not only that, there are few issues. EDPT is very important, early diagnosis prompt treatment. And many cases, why we lost, if you compare with the dengue and the corona, the mortality in dengue is higher. Because you know the dengue, hemorrhagic fever, dengue shock syndrome, when the patient thinks that they already survived and patient getting cured, they can go home without tension. But when they go home, to go back home, later on they develop the dengue shock syndrome. And later, when the patient arrives again in the hospital, there's no way. And lastly, the patient just develop shock and very drastic condition. There are very important key multiple factors involved here, like multiple stakeholders involved in dengue management. Local government, who will do what? Medical treatment. Medical treatment usually ensured by the medical college hospital, and we have district hospital, general hospital, rural health complex. They organize this treatment facility. In our country, from DGHS, the CDs of DGHS, they arrange at least once a month, online training session for doctors and those who are the managers for treatment, updated guideline of the dengue management. So, online treatment is going on. In addition, the environment control, who will do what? Usually, matter control and environment management is done by the local government. So we can identify what are the activities to be carried out for dengue control and who will do what. Please make a checklist and take in the responsibility for each activity. This is very important. Then we can make a concrete dengue elimination control plan in the Chirayu City Corporation. Then hopefully the rest of the session of the day today, we shall arrange a group work, and each group will make a good presentation, and with the presentation, updated presentation, we shall review and we can make a healthy and concrete practical, which is doable, work plan for dengue control situation in the Chirayu City Corporation. Thank you very much.